And critics from Nepal. This is me, Surendra Bajracharya, presently working at Autism Care Nepal Society as Chief Administrator. I'm a 34-year-old with an educational background with physiotherapy, public health and public administration. Since 8 years, I've been working here at Autism Care Nepal Society and really glad to work in this field. So when we talk about the policies and the laws regarding the disability issues, Nepal government has addressed the autism issue in our national constitution of 2015, including all different disabilities and highlighted autism too. We are glad that National Disability Act 2017 has addressed autism as a separate disability category. Along with that, we have an Educational Act and inclusive policy here in Nepal following the Sustainable Development Goal. First of all, I would like to give a very brief introduction of Autism Care Nepal Society. Autism Care Nepal Society was established on 2nd April 2008 on the auspicious occasion of World Autism Awareness Day. Since the beginning, Autism Care Nepal Society has been working for advocacy awareness of autism here in Nepal. We can see a drastic changes within this 12 years time period where the autism community has been addressed so far in the society. So Autism Care Nepal Society has its own mission too. So our mission is empowering people with autism to protect and promote their rights and utilize their skills to have a meaningful and effective participation in the society. With this mission, Autism Care Nepal Society has been providing different services to different programs. We have a teachers training program, we have a parent and child training program, we provide different diagnostic and assessment services along with therapeutic interventions, we provide a free counseling, definitely we work for the awareness and advocacy programs, and we have different outreach programs here in 5 provinces of Nepal so far. Autism Care Nepal Society is a national center run by the parents. We have more than 600 active members, including the 7 executive board members. With the active 35 staff members of Autism Care Nepal Society and with the 5 volunteers, we have been working smoothly to provide services to autism community here in Nepal. We are now at 5 provinces of Nepal among the 7 provinces, and we are glad that our services has reached to grassroots level and we are still working on that. So while talking about the top 3 priorities, currently we really want to establish our National Care Center for Autism here in Nepal. We want to develop autism-friendly policy to address the need of persons with autism here in Nepal. And we want to decentralize our various services and programs to different parts of Nepal so that we can address the autism community at the rural areas too. So far we have lots of challenges. Inability and lack of knowledge and sensitization among healthcare professionals on autism leading to late diagnosis. We lack the education system and definitely lack the professionals. The economic constraint is the major barrier, including the country attention. Lack of training centers, especially for occupational therapy and speech language pathology, is the next challenge we have. The policy formulation, implementation and monitoring gap is the next challenge we have been facing. And we lack of disability, we have lack of disability data, so the autism number is still not addressed here in Nepal. Still the autism is dependent on the parents and it's parent driven. And we lack the research as the next challenge. So the possible solutions may be training to healthcare professionals. We would like to have international networking and to have learning platforms, strong advocacy and lobby with the government for the policy development and implementation may be the next step. Professionals and paraprofessional development programs need to be established within the country. Survey and determination of disability segregated data need to be performed. Community and government responsibility and refillings need to be developed. We would like to have more resource programs and different fundraising programs in upcoming days. At present, Whole world is suffering from COVID-19 pandemic. This pandemic has severely affected the whole world, and Nepal is also badly affected. However, during this pandemic, we have tried our best to cope with the situation and help our parents and persons with autism to address their issues. So the possible plans and activities what we are supposed to do in near future in context of COVID-19 pandemic, we are really looking forward to have virtual school sessions regularly so that we can help our children at home environment. We want to have different webinars and international virtual programs so that we can learn from each other. The panel discussions, workshops involving the parents and the caregivers may be the next program which will be performed virtually. And we definitely want to learn from the different countries what they have been doing so far in the autism community, and we want to learn and act accordingly to help and support our community here in Nepal. Lastly, I'm very much glad to be part of Advocacy Leadership Network Conference. I'm very much thankful to the whole team for organizing such a wonderful conference and looking forward to hear from you all. Thank you very much, and bye from Nepal.